even after some people recover from COVID, some of them continue to face persistent symptoms like chronic cough and fatigue and brain fog. And now there's evidence some younger people are getting type 1 diabetes. For more, we're joined by infectious disease specialist, Dr. Bogoch. Haven't seen you for a while. Good morning.
Hey, good morning. Great to see you, Anne-Marie.
Can you explain, first of all, this connection between COVID and type 1 diabetes, especially when it comes to youth?
Yeah, unfortunately, when people get a COVID-19 infection, there's often a cascade in the body. You mount an immune response, and we know type 1 diabetes is an autoimmune condition where a body will attack, unfortunately, itself. And in this point, in this condition, it attacks some special cells in the pancreas. There's probably a link between the development of antibodies during COVID and in a very small but not insignificant number of people. Sometimes there'll be a cross-reactivity, and those antibodies end up setting off a cascade that will ultimately lead to the production of antibodies that does end up attacking the pancreas in a small number of people. It's real. It does appear to be a real association. Fortunately, it's rare. But again, it's yet another more long-term complication of COVID-19 that we're seeing. As
a parent, if I hear that, and I hear you say that there is a connection, even if it is rare, what should I be looking for after my child has COVID-19, and should I be heading to the doctor to get checked?
Well, for starters, I think we should take a quick step back and recognize that there's acute manifestations of COVID-19, which we're all aware of, and then more longer-term manifestations like long COVID. Diabetes, for example, type 1 diabetes is a tough condition, and I know there might be many people out here that have it or know someone that has it. And when it's diagnosed, sometimes people report extreme thirst, and they're drinking and drinking and drinking a lot, and sometimes there's weight loss, and there's frequent urination as well, and that's related to the high blood sugars that people will have that really stimulates those symptoms. But again, I think it's fair to say that this is a rare issue. Some studies have demonstrated a real link. There's other studies that don't demonstrate a real link. I think there's still a lot of unknowns here, but no one would be surprised if this ends up being a real link, as we have seen in a few studies so far.
All right, what are some of the other chronic non-infectious diseases that people are now facing after they recover from COVID?
Yeah, unfortunately, within the 6 months to 1 year after recovery from infection, there is a rise in blood clots, both in the veins, so that causes deep vein thrombosis or pulmonary embolism, that's a blood clot in the lung, and there is a small but real increase in the number of heart attacks and strokes after infection. Now, it's important to look at things like absolute versus relative risk. The absolute risk of this is actually pretty small, but the relative risk of this is higher if you've had COVID versus if you haven't had COVID. So that's an important thing that often gets missed, absolute versus relative risk. So blood clots, we see some people develop brain fog, some people develop shortness of breath, some people have fatigue that's persistent after COVID-19. Safe to say that there are, unfortunately, many complications after COVID-19 that we don't fully understand. Hey, the best thing you can do is prevent yourself from getting COVID in the first place.
Dr. Bogoch, what differs from the diseases that you've mentioned from long COVID?
Well, long COVID isn't very well defined, unfortunately. And when we talk about long COVID, sometimes we're having multiple different discussions. It's often thought of as an umbrella where we have lots of different conditions underneath it. And one of the issues we're having is that sometimes you see studies come out, but they're defining long COVID differently. So I think that moving forward, we really need standardized definitions, a standardized way of measuring this, more funding to support research into looking at long-term complications of COVID, and of course, more funding to caring for people that are suffering with chronic manifestations and symptoms after they recover from the acute infection.
Dr. Bogoch, great to talk to you again. Thanks so much.